Hello everyone. In this video, I'd like to talk about the research on sound therapies. During a session of sound therapy, the child or adult will be listening to some sounds or some music that are supposed to help with speech and other difficulties. So let's see what the research says about them. So here we have a study from 2023. I have started to add the year of the research studies now because I think it's quite relevant. So we have initial outcomes of the Safe and Sound Protocol, that's a sound therapy protocol, on patients with autism. The Safe and Sound Protocol is a listening program designed to improve social communication skills by reducing auditory hypersensitivity. That is when the individual will say that the sounds are too loud, which is quite common in autism. So in this case, we have 6 participants with autism. They are adults between 21 and 44 years of age. In this study, only the social awareness scale showed a significant improvement after the intervention. So in this study, they assess other areas such as like depression or anxiety, and they didn't find any significant improvements in those areas. So that was the abstract. We have a bit of the study here. They are always like just abstracts of the study. That's not the whole study. If you want to find it, you have the links here and in the description. It says that individuals with autism may have neuroceptional dysfunctions due to the sensory processing abnormalities, and therefore they may not be able to switch the defensive behaviors effectively due to the lack of perception of the environment as safe enough for social interaction with others. That's quite an interesting theory. This protocol is an intervention based on the polyvagal theory for improving the social communication and reducing auditory hypersensitivity. Previous studies with children with autism using an early version of the Safe and Sound Protocol reported significant improvements in their sensory problems, including auditory processing, listening, and hearing sensitivities. So we'll have a look at one of these earlier studies with children after this one. So the intervention comprised 5 daily sessions of 60 minutes each, and they were listening in this session some altered or processed music through headphones to help with these difficulties. And finally, the discussion says each participant showed unique post-intervention responses. So the response was very individual to this protocol. For example, in one case, the individual had some psychological conflicts within the family 1 month after the Safe and Sound Protocol. These conflicts were resolved after 3 months after the intervention, and the participants' adaptation to daily life had improved. So this protocol brought up some problems that were already there. It brought them to the surface, so to speak. And this way, they were able to intervene and improve the quality of life of this patient or participant. In another case, the family reported an improvement in the participant's responsiveness. However, the participant did not report any subjective change. The participant himself or herself didn't notice any improvement in their difficulties. In another case, they were older than the other participants and reported an increase in her awareness and self-regulation of hypersensitivity itself, rather than an improvement in the auditory sensitivity. It's more like she was able to regulate this hypersensitivity rather than the hypersensitivity having gone away, which is quite beneficial as well. Another participant suffered from nocturnal insomnia since childhood and slept through the night without awakening after the protocol. The family reported improvements in self-control of vocal volume as well. We see there are improvements in many different areas in different individuals, so the response can vary a lot with this protocol. And the conclusion was that the protocol led to an improvement in the social awareness. That's what was statistically significant. On the other hand, this protocol did not improve the pro-social behavior in these adults as it did with the children of previous studies. This might be due to differences in neuroplasticity. It could as well be, as children's brains are more plastic. This is one of the studies that have been mentioned in this previous study, where the participants are children. This study is a bit older, from 2014. Back then, the protocol was called Listening Project Protocol and not Safe and Sound Protocol, but the principles were the same. This study was with children diagnosed with ASD. This protocol is based on a theoretical neural exercise model that uses computer-altered acoustic stimulation, that's basically music, to recruit the neural regulation of the middle ear muscles. This has to do with the polyvagal theory. So this protocol is supposed to reduce the auditory hypersensitivity and increase the neural tone of the middle ear muscles to functionally dampen competing sounds in frequencies lower than human speech. The trials demonstrated that this protocol, when contrasted to control conditions, reduced the auditory hypersensitivity. This study had trial 1 and trial 2. It included a total of 86 participants in the filtered music conditions. That's the protocol. It included 86 participants in the filtered music condition. That is the protocol. 32 participants in the unfiltered music condition. So that's not the protocol, just music. And 28 participants just wearing headphones with no sound. So about the participants, later in the study, they mentioned that the participants were young and on the severe end of the autism spectrum. So the findings may not generalize to older or less severe autistic children. So that's good to know. Here we have the results. We have some graphs. I think that would be quite interesting to have a look. In light gray, we have filtered music. So that's the ones that are following the protocol. And we can see the improvements in all these areas. Here we have behavioral improvements after 1 week of the protocol. We can see that it is quite significant compared to headphones only with no sound. That's on the trial 2. Again, light gray is the treatment group or the group that received the protocol, and that's also after 1 week of treatment, the improvements that they experience, which are quite significant. And finally, we have the discussion. They say data from both trials confirm that the protocol, that's the filtered music, selectively reduce auditory hypersensitivity. And on top of that, within the filtered music groups, that's the treatment group, the children with auditory hypersensitivities who improve following the protocol significantly increase their spontaneous sharing behaviors. So these are the pro-social behaviors that they were mentioning in the previous study, that only children show that improvement. Here we're moving on to Johansen individualized auditory stimulation. So that's a different sound therapy, which is quite interesting as well. Sessions are much shorter with the Johansen's therapy. So it's about 10-15 minutes every day, listening to altered music as well. And it lasts about 8 to 12 months. In theory, the Johansen therapy, the connections within the language centers become faster and therefore more efficient to process language. And for these reasons, the areas that can benefit from the Johansen's therapy are communication, coping with background noise, so a bit of auditory processing, auditory memory, and reading and spelling. So a lot of what has to do with language and processing of sounds and speech. So here we have a study about these therapy in a group of dyslexic students in this case. These students, they also had auditory processing difficulties, and they showed significant improvements in language skills following this therapy. They selected 28 participants aged 13 to 17 years old, and they were divided between a group of dyslexic, an intervention group, dyslexic control group, so no intervention, and a non-dyslexic control group. They listened individually for 10 minutes daily over 15 to 18 months to see this computer-generated music, customized according to the results of the hearing test. So there is an assessment and some tests, and based on that, they designed some CDs that are personalized to help with the difficulties that the individual is presenting with. The statistical analysis provided some evidence of specific effects of the intervention, most clearly with respect to the audiogram, that's like the hearing test, but also non-word reading, phoneme analysis, spelling, and rapid naming of words. The evidence was ambiguous with respect to text reading. We'll see some graphs about that, so that will make a lot more sense. Group 1, that's the treatment group, improved only marginally more than group 2. That's the dyslexic group with no treatment. Here, we need to be aware of the learning effect. That means that if an individual does the same task or the same activity twice, one before the treatment and another one after the treatment, there might be some learning going on there between one and the other, or a little bit of practice, you could say. It is to be expected that even the control group might present some improvement despite not having an intervention. So reading aloud, here we're scoring the number of correct words. So we can see there is a little bit of improvement in the treatment group, that's group 1. Group 2 has about the same improvement, and group 3, that's children with no difficulties and no treatment. They had no improvement, so nothing really significant there. So here we have the number of correct words, or better said, non-words, because it's a non-word test. We have group 1, there is quite a bit of improvement. Group 2, barely an improvement, and even group 3 gets a bit worse. So I would say that is significant to me. This is the phoneme analysis. That's the number of errors. So we can see that in group 1, they go down almost to half. Group 2, they go down a little bit. And group 3, they go up, in fact. This task, just to know what we're talking about, the participant was read a non-word, then asked to repeat the word, omitting the first, second, or last sound. And that was 20 words in total. So that was the task. And group 1 significantly improved in this task. Spelling, so that's a number of errors. We can see a big improvement in group 1, the treatment group, little bit group 2, and no improvement on group 3. So that, again, to me, that's significant improvements in spelling as well. This is a study in Scotland. I found this in the Johansen website. I could not find this in any research papers, so I'm assuming it has never been published externally. This is a study from the 90s with 25 children from Scotland, 10 girls and 15 boys, between the ages of 5 and 12. They were presenting with a primary speech and language communication disorder or a specific learning difficulty, for example, dyslexia. So here we skip to the results. The observations of both parents and teachers were analyzed by counting the number of times an area of improvement was noted. So let's have a look what these areas are. So you have all these areas: self-confidence, speech and language, relationship with others, etc. And that's how much improvement teachers reported in green and how much improvement parents reported in each area. We can see that there is some discrepancy in some areas. For example, relationship with others. Parents reported a lot more improvement than teachers. And this can be due to different variables. For example, in certain areas of these children's lives, it could be better observed. For example, reading or concentration would be better observed at school than at home, while maybe relationship with others is better observed at home. We don't really know the exact details in this case. So that could be a bias. And they could also be parents' bias. That means that parents want the children to do so well, they want it so much, that they start seeing improvement where there is none or there is less improvement. I think that was the last study I wanted to comment. So I hope this was interesting and hopefully helpful if you want to consider these therapies, if they might be helpful to your child. I'm aware that they are quite cost effective, they're not expensive, so it's worth a try if you think that might work. Thank you for watching. Goodbye. If you like this video and think that others can benefit from this content, please like, share or subscribe. It all helps me reach more people, and I'm sure it can make a big difference to many families. Thank you.